Okay, welcome to the deep dive.
Great to be here.
This time we're diving into the world of emergency medicine. It's a pretty demanding field.
Absolutely. High stakes.
Yeah, knowledge there isn't just power, it can literally be a difference maker. So for anyone learning it or even practicing, having the right resources is, well, crucial.
Totally agree. And that's what we're looking at today. Some information about a resource designed for that specific environment.
Okay,
It's a book called 100 Questions and Answers in Emergency Medicine. The author is Dr. Atef Ahmed.
got it. So our mission today is really to unpack what our source material tells us about this book. What does it claim to do? How does it position itself to help medical learners get a handle on emergency medicine?
Right. And based on the description we've got, the core idea is, well, pretty straightforward, but sounds effective. It's presented as a comprehensive guide,
Okay.
and it uses a question and answer format. The source really suggests that structure is key to how it works.
Interesting. Q&A.
Yeah,
And the author, Dr. Atef Ahmed, the source mentions him.
it does. Describes him as a, quote, renowned figure in medicine. Says he has years of clinical experience and teaching experience, too.
Okay, so that background immediately suggests, a certain level of expertise the book is trying to capture.
Exactly. And the source, it frames this resource as much more than just a standard textbook.
How so?
It states its purpose pretty boldly to uh, unlock the complexities of emergency medicine.
Unlock the complexities.
Okay.
Yeah.
And the claim is that it's meant to be an indispensable tool for anyone on that educational journey, whether you're a med student just starting out, a junior doctor, or even an experienced emergency physician.
Indispensable tool.
Well,
That's definitely a strong claim. Does the source give reasons why it's supposed to be indispensable?
it does list several points. One is expert insights, which, like you said, ties right back to the author's experience.
Right.
It implies you're getting knowledge that's been, tested in the real world.
Makes sense. What else?
Well, alongside that expertise, there's a big emphasis on the engaging format.
The Q&A again?
Exactly. The source says it's not just like a random choice. It's specifically designed to enhance recall and facilitate deep understanding.
Recall. That's interesting for emergency medicine, right? You need that info fast.
Exactly. It suggests the book is built for quick, practical knowledge retrieval under pressure, not just sort of passive learning.
Yeah, you don't often have time for leisurely reading in the ER. What about the content itself? Is it broad?
That's another key point, comprehensive coverage. The source claims it spans a, quote, vast array of emergency scenarios.
Okay.
So it's aiming for a really well-rounded knowledge base,
Yeah.
covering the common stuff you see all the time, but also those rare critical conditions you have to know about.
And does the source give examples of that coverage?
It does. It lists some pretty core topic areas, things like trauma care, resuscitation, advanced life support, the absolute pillars of emergency care.
Yeah, the non-negotiables.
Yeah. And it also mentions emergency procedures, diagnostics, and treatments. So basically, the hands-on stuff and the whole process of figuring out what's wrong and what to do about it.
Okay, so the practical elements too.
Plus, foundational things like emergency triage and critical care. So the description really paints a picture of a book trying to cover, well, pretty much the whole patient journey through the ED.
From door to critical management, that's ambitious.
Is quite a claim for breadth, yeah.
The source also mentions it's ideal for exam preparation. How does that fit in?
Well, it highlights that the explanations apparently go beyond just giving you the answer. They focus on explaining the why behind it.
Ah, the rationale. That's crucial.
Absolutely. Whether it's for an exam or a real patient, understanding why you're doing something is key. It's about building that deeper clinical reasoning, not just memorizing facts.
Makes sense.
And that ties into the next point mentioned, real-world application. The source claims the book offers insights into, practical application, critical thinking, and those really vital decision-making skills you need in such a high-stakes environment.
Yeah, that's where it all comes together in emergency medicine. So the source isn't just presenting it as a study guide.
No, not at all. It seems to be framed more as a pathway, a way to really understand the core principles and, crucially, how to apply them effectively.
Like a tool for building competence.
Kinda, yeah. It's even described as representing a commitment to the excellence and precision required in emergency care. So it positions the book itself as part of that commitment.
And the ultimate goal, according to the source, what does it say the book aims to achieve for the reader?
The bottom line, as presented, is to equip you with the knowledge and skills to excel. And it even says it can serve as a first step toward becoming a confident and competent emergency medicine physician.
That's a pretty significant promise for a book.
It is. So if we pull together everything the source material tells us about this 100 questions and answers in emergency medicine,
Okay, let's summarize.
it's presented as this comprehensive Q&A resource.
Yeah.
It leans heavily on the author's claimed expertise.
Right.
The source positions it as, well, maybe indispensable, definitely a tool designed to boost recall, cover a wide range of EM topics.
Explain the why, not just the what's.
Exactly, and
Wow.
build those critical thinking and practical decision-making skills needed for the ED.
So it sounds like the source really wants you, the learner, to see it as something specifically built to help navigate the complexity and the sheer dynamism of emergency medicine.
Yeah, focusing not just on knowing stuff, but being able to use it confidently and effectively under pressure.
Which really brings us to a broader thought, doesn't it? I mean, considering how fast emergency medicine changes, new procedures, new evidence, and that constant need for rapid, accurate decisions, how might structured resources like the one described here fit in long term?
You mean beyond just the initial training phase?
Yeah. Could things like this play a continuous role, throughout a whole medical career, helping professionals stay sharp and adapt in such a demanding field? Something to think about.